Hi, I'm Amy Wilson. I'm a longtime member of the Discovery class. I work at Baylor University Medical Center as the Chief Medical Officer. I'd like to recognize a couple of my colleagues who also go to Wilshire. This includes Rita Hamilton, Nestor Bunda, Alan Wright, Joni Cabanis, and others. So I'd like to let you know what's happening at the hospital right now. We are definitely dealing with COVID-19 and have been for several weeks. It's a sharp learning curve for us. I know that on the news there's a lot of concern over personal protective equipment or PPE. I work in an organization that is going to the ends of the earth to secure this for us, and they've been very successful. We also are working hard to conserve our PPE through creative methods. So one concern I wanted to mention to you as a healthcare provider is that we've noticed that people aren't coming to the hospital as much with urgent or emergent conditions like stroke and heart attack. This worries me that people are not attending to this, and I'm worried that people are staying home because they're afraid to come to the hospital. I'm assuring you that the hospital is a safe place. We're still open 24/7. We are still delivering babies. We're still treating cancer and other conditions. I want to also just let you know that it's important that you seek care urgently because lives are saved and outcomes are improved this way. Also, I want to assure you that your efforts that you're doing right now are making a difference for all of us. The social distancing that you're practicing, the hand hygiene, going virtual, all those things are making a difference for us right now, and our curve is flattening. I wanted to share some faith-based experiences. We pray at work a lot, and I'm very fortunate to be at an organization that is faith-based. So I'd like to share two stories with you. One is something that Alan Wright did when he was leading a prayer last week. He gave us a message to remind us of mindfulness, and he did this by asking us every time we did hand hygiene or used hand sanitizer to just be mindful and in that moment, and it was very powerful as a healthcare provider in that moment. Second, I'd like to just mention that the hospital is truly a place where people of all faith and those of none come together as one on one team. On a call I led this week, our prayer time was led by one of our older Jewish physicians. He relayed a story, a poignant story of his parents during the Holocaust. And it was a message of hope that if his parents could live through the Holocaust, then we also had hope that we would live through COVID-19. Every time we pray at work, we ask everyone to pray to that which is holy to them. And I'm very fortunate to be at a hospital that honors faith at a time of stress.